Good afternoon, everybody. Welcome to Dental Voice with Xyrus. My name is Rolando Mia, and we're here with an incredibly special and inspiring guest. The purpose of Dental Voice is to give people an opportunity to share their experiences, their stories with us here. And today we have an incredible lady. I am going to introduce you to Amber Young. Now, Amber Young is special because when you look at Amber's story, which she's going to tell you, it's going to blow you away. Amber is not only a mother, she's not wife entrepreneur, she's an oral cancer survivor. Now, this is called Dental Voice. She's going to share how her dentist effectively saved her life. Amber has inspired me because when these things happen, you can choose to become a victim of your circumstances, or you can choose to kick its butt. And Amber's going to show how she kicks her butt. So it's butt. So Amber, thank you so much for joining us. Really appreciate it. How are you doing?
I'm good. Thank you so much for having me.
Oh my gosh. So I want to jump right into this. And I met you during one of the shows. I think it was at the Hinman. And thank you, Dr. Mark Hyman, for introducing us. He is absolutely amazing. Don't tell him I said that, but he is amazing. Could you, if you would, share your story with us and kind of what's happened to you and what's your what's you? Just let's go there.
Well, thank you for the opportunity. I am 42 years old now, but when I was 35, I had recently relocated to our area where we are now in South Carolina, and we needed to get new dentists and doctors and all that lined up. So magically, I got that $99 new patient coupon in the mail. Everybody knows them, and you send them out. Well, we got one, and I made the appointments for the whole family to go to the local dentist. And when we got there, they had my daughter in one room, my husband in another room, and myself. And they offered us, as part of that new patient exam, a panoramic and an oral cancer screening. So the oral cancer screening was an additional fee at the time, and I agreed to have it. No big deal. I knew I was going to have some dental work done. And at one point, the entire office team came in, the dentist, the office manager, and said, "We need to talk to you. We've compared they used the Velscope at that time and your panoramic, and it seems that you have a dark spot." And I didn't understand what that meant. And they said that they could not do the proper exam there and imaging. So I needed to go see an oral surgeon and get better, like 3D imaging. So they were very kind and courteous and told me, it's going to be okay. You're fine. Well, let's make this referral. It's no big deal. And we lived on the border of a state. I lived in South Carolina, but we were right on the border of North and South Carolina. And the referral they had given me was in North Carolina. And when I called, my insurance wasn't accepted.
Mm.
So I didn't go.
Oh, wow.
That's the big part, is that I didn't go because I didn't understand and I didn't feel anything wrong. This is after surgery, so there was no sorts of pain or symptoms to think that a dark spot meant anything.
Right.
And about a week passed by, and the office manager called me to follow up. She said, "I want to know what the results were at the oral surgeon." I said, "Well, I didn't go." And she immediately told me that that was unacceptable.
Right.
And right, I said, "Well, my insurance wasn't accepted." Yeah, so she got on my tail, and she said, "We're going to find somebody that will take you." So they worked diligently and found someone in the state that would take me right up the street. And when I went there, they did the 3D panoramic and imaging, and that dark spot ended up being a golf ball size tumor, essentially, and it was growing inside my jawbone. So it was in my mandible,
Right.
and it was slowly breaking my jaw, but it was pushing my nerve out of the way at the same time, so there was no pain. And if you'd done regular palpitations and visual, you wouldn't have been able to see anything because it was so internalized inside that we had no idea it was there. So he did a biopsy at this time, and a surface biopsy and sent it off. And we waited for those results. They came back non-cancerous. So I thought, this is fabulous, but the tumor was too large for him to remove in his office. So at that time, they referred us to MUSC, which is in Charleston. So it's about 3.5 hours away. And I rode down to the dental school there and went in to have the appointment. And the first thing that the head of the dental college said was, "I know you're concerned about pathology." And I said, "No, they told me it was non-cancerous. I'm not worried about it." He said, "No, something happened that we've never seen with the K19 dye. And we really just need to biopsy the whole surface," which was fine because they were going to take it out. So I didn't care. And so we did a surgery on April 9th of 2015 and removed the mass. And at that time, he told my husband it was clear, it was round, there was no nodules. They didn't see any reason to be concerned, right? So we trekked off, went home, and just waited for the results. They said it'd be a couple weeks. So when they called, we took the family. I took all my kids with us. We were going to the beach. It's a day trip. I mean, it's 3 hours there, 3 hours back. We didn't have anything to worry about. And when I went into the room, my husband and children were sitting in the window, and about nine doctors walked in, and the interns, they lined the hall at the medical school. And I remember looking at my husband, knowing my daughter was 8 and my son was 1, that this conversation was going differently. And they started to explain that they had never seen this type of cancer. They really didn't understand what to do with it. That the 5 things they mainly told me were that it was 95% aggressive. It kills everybody within 5 years. There's nobody in the world alive with it right now. Chemo and radiation aren't effective treatment plans on this type of cancer. And they were just going to send me home and go to tumor board and oncologist, radiologist, and really come up with a plan. So I remember looking at my husband in the window, and I had about 1 second to make this decision. And I said, no. And we went outside, and I heard what they told me, and I Googled it. I went to Google in 2015 and looked up clear cell congenital carcinoma. And that's a mouthful, to say the absolute least. And there was nothing. There was like no data. And I thought, well, that's bonkers. So we went to the beach. We spent the day. We did everything. We rode home in silence for 4 hours. And I immediately went into research mode, right? I immediately needed to figure out what I was dealing with. So we bought all the case studies. They were third world countries, early 1980s. We read all those and they were horrible. So we decided to not really care about that data. I researched, I did everything. I called the Center for Rare Disease Control, the CDC, and they told me I was too rare for them, that it has to affect a certain number of people to get research money. And I just didn't know what to do. So from April 21st to May 30th, the doctors kind of made a plan. They got together, did whatever they could do. And on May 30th, they called and they said, "Okay, this is what we're going to do." He said, "Bear with me. We're going to do basically this radical surgery, and we're going to take the widest margins we could possibly take and remove your entire right mandible." And because of the size, they cut out from my ear all the way to my front jaw.
Wow.
They said, "We have to replace it, the tissue and the arteries. So you're going to have to either give up a fibula or a scapula and make a decision so we can do the transplant and make essentially what they call my flap." And so bare minimum, I wasn't going to be able to eat or talk. So I thought, well, I need to at least be able to walk, because we had a 2-story house and small kids. So I chose my scapula to be the viable transplant for my flap. They said it was going to be unknown if insurance is even going to cover this. Like it was radical
Wow.
treatment.
Wow.
Yeah. So I got scared. I got so scared. I didn't know what to do. So that day I did what probably anybody in my boat would have done, and I started a GoFundMe page.
There you go.
Right. And I really didn't raise any money, which is okay. But within 24 hours of it being shared in public, I had someone reach out to me and say, "Can I have your personal information?" Because they don't give that out when you do
Right.
GoFundMe's.
Right.
And I
Right.
said, "Okay." They said, "We know someone that can help you." I said, "Okay, I'll take any help in the world I can get. Like, no qualms here." So immediately she gave my information to who I now know is, I call her my earth angels, and that was Linda Miles. And she had this nonprofit called the Oral Cancer Cause, her and Robin Morrison. And Linda called me, sweetest lady, and is like, "It's going to be fine. You're going to be okay. Tell me your diagnosis." And I said, "Well, it's clear cell androgenital carcinoma." And she said, "Oh, I know somebody with that." And not knowing who I had on the phone, I said, "The hell you do?" And she said, "No, his name is Tim and he lives in Philadelphia. We helped him last year." And immediately from being the only person in the world with this type of cancer, I had a wheelhouse of people. I had a
Oh,
community.
wow.
I found my what I call cancer brother. He's the only other known survivor. He's on his fourth transplant and fourth surgeries because of the aggression and the cancer that keeps returning. So we really went into it knowing that I was going to have this radical surgery. It was 22 hours on the table. So I have what I call it my bicycle chain. It looks like it's a metal chain and made out of titanium. And then my bone and tissue from my scapula, which is what you see here. It stays all the time. It doesn't go anywhere. It's actually been reduced once because it was much larger. They padded it from the surgery. And then they reduced it, and I chose to leave the excess tissue because I've seen people whose scar tissue spreads and opens, and
Right.
then their titanium falls out, and you have to have a transplant or a skin graft.
Wow.
So that's basically my surgery journey. And since then, I went 7 months and I didn't have any food. Um, I opted and worked really hard to come out of the hospital and not have to have a feeding tube, because I knew in the long run that I would not make a comeback from having a feeding tube, essentially.
Yeah. Yeah.
And I went through physical therapy for my arm to regain mobility. And then I had trismus in my mouth because the muscles, I had to retrain them how to operate. And I wasn't able to open my mouth larger than an eighth of an inch. And I would go to the physical therapist and probably do some therapy I wasn't supposed to do with something called an H wave, which is like a TINS unit. And they put the nodes on your face and shock it essentially. And it would relax my muscles enough that I could open my mouth for about 30 minutes. And it was the only time I could eat. So I would run to the nearest restaurant and get as much food as like anything I could get and put it in my mouth before my muscles retracted. And so
Wait.
everybody within a 10-minute mile like radius of there knew I was coming. If it was therapy day, I was
I'm
coming to eat some
eating.
food.
That's kind of like
Yes.
food, but it's very different. First of all, Amber, I'm blown away. You'd shared portions of your story with me, but that feels, I'm not experiencing devastating. How did you get through that? And I mean, it started with your dentist. Is that what I understand?
Mhm. Yeah, I had a diligent dentist. So the, the hard truth is if I hadn't have gone to the dentist that day and they had
Mm.
found it, my family would have, honestly, they would have found my silent killer via autopsy. It was millimeters, and I mean millimeters, from entering my bone marrow channel. And I didn't know that was, I didn't know you had a bone marrow channel in your mandible. Like I know a lot of things about anatomy now and jaw and dentistry that I never knew before. But if they hadn't have found it, it would have killed me within probably a few months. Um, we didn't know that, without having any pain or any symptoms, to go from that to, hey, we're going to cut out your jaw.
You need your body to fill it in with.
Yeah. And it was very hard for a long time to try to understand, being the only person, but then being such low survival rate and statistics. um I fought so hard and went immediately into recovery mode, that I didn't deal with the mental struggle until probably 2.5 years in. Ironically, I was on a boat and sharing my story. And the fun part about it was when you're on a boat, you can't go anywhere else. Right? You're with those people. And someone came up to me after I kind of shared my journey and said, "How many days are you into your 5-year diagnosis?"
Right.
And at that point, I hadn't thought about it. And I went back to my cabin that night and I counted the days since the surgery. And I went into such a spiral because I felt at that point I'd done all the hard work. I got through the recovery. I did all the things. I was okay. I could talk, I could eat. That I hadn't dealt with the fact that I may only have 2 more years left. And I was halfway through. I was like, I may only have 2 more years. What am I doing? What, what am I doing with my life? What am I going to leave behind? Or my kids going to be okay? And I went on a different path for a little while, and it took me on a journey of self-discovery, to
Right.
say the least. I had to come to terms with the unacceptable. I had bought a 5-year planner, and I would not put anything on the calendar past that day. I wouldn't. It was April 21st, 2020 would have been the date. And in my mind, I was going to have this grand party that I lived through it. I survived the day. I beat the odds, all of this stuff. And I, ironically, the universe, and be it whatever your spirituality is, gave me something that I didn't anticipate. And I have a baby, right? Yeah, I don't know if you know this. I was 40 after cancer, and I had a baby, and she was born March 4th, 2020. And it made me have to focus past that date. Then we got COVID and everybody went home. Nobody could do anything. You couldn't go out. I couldn't have that party. I wasn't allowed to do that. So it silently slipped by, this date that I had built up in my brain so
The
long.
day.
That day was because no one else has ever done it. And it just kind of slid by in the night, and it had like a vessel, and it was gone. And one day I was sitting there and I was like, well, huh, I did what I
Here. Cool.
now what? Basically. And I was okay, let's move along. And now I'm 2 years past that. So I'm 7 years out at this point.
Oh, that is so incredible. And you are now the executive director, if I understand correctly, for
Mhm.
the um, oral cancer cause. Is that correct?
Yes. So when I tell you that I had a conversation with Linda Miles that day, I found out about my surgery. I hadn't gone to surgery yet. My surgery was going to be in June, right? It was going to be they gave me 1 month. So I had a month to get ready for this big surgery. I had 10 days in the hospital and all these lovely things along the way. but it's so interesting that on every step of the way, I was challenged. I
Right.
was I
Yeah.
was challenged with things that honestly wouldn't happen to other people. Let's just put it that way. I'm a lucky duck, if you would, in the realm of
But
in the realm of
you chose not to give up, which is so
so
important.
about a week after my conversation with Linda, I got a card in the mail and it was from the oral cancer cause. And then it was a substantial check. And it said it and I'll never forget it. It said, please put your son in daycare while you're going through recovery. Now, I hadn't processed the fact that I wasn't going to be able to talk or eat or function or take care of my kids or drive. And I was so taken back that a group of strangers would do this,
Would reach out.
that would reach out and supply us with the ability to help our family out of the blue. I didn't know them from literally Bob. And in a time where things change for you emotionally and physically, like when sometimes when you get a cancer diagnosis in your family, people you think that are going to be there aren't the ones that end up being there because they don't know how to address it
How to engage, right?
and how to engage. And when you feel completely alone, like the only person in the world, 1 out of 7 billion is like a really big number. And I was just so amazed by their kindness. And Linda told me, she said, I have a plan. I have a grand plan. And I said, okay, whatever you want, lady. And that's basically what happened. Well, after all of my recovery and my surgeries and things in between, I fought to keep my ability to speak.
Mm.
And she said, now's the time for you to use your voice to help the others who lose their ability to speak or their pieces of tongues or their palates or their teeth and can no longer do that. And so I came on board to help them educate about early detection and then to help raise funds to help other survivors and other family members.
So cool.
So, yeah, and part of the journey through that time was Linda asked me to show up one day to a presentation, and it was the first one I was ever going to do. And I was scared. I had just been to the nutritionist because I was dying. I couldn't eat. I'd lost about 65 pounds at this point, and I'm a small framed person, and I knew that I needed help. So I went to the nutritionist at the university and asked, how can I put on weight? How can I do this? And they gave me some not great information. And they said, you have to have these high fat, high sugar shakes with whole fat milk, carnation instant breakfast, peanut butter, and all these things. And I told them at that point, I said, I'm not the smartest woman in the world, but I know that this cannot be good for my body or my cancer. And he said, do you want to live or do you want to not? And I said, there's got to be a better way. But this presentation Linda flew me to happened to be AOSH, the American Academy of Oral Systemic Health. And I snuck in to every presentation, which is, I should probably pay them for it, but I did.
I won't tell anybody. Don't worry.
I did. I snuck in, and all they were talking about was your anti-inflammatory system and the foods that you consume and giving yourself proper nutrition. And I was like, wait a minute. It was so timely. I was like, wait a minute. I could save my own life. I can figure this out. I can give myself good foods. I can start doing all of these things. I immediately left that presentation and enrolled in health coaching school and then life coaching school because I knew that information I had was going to help people down the road, right?
Ah,
If I could help somebody, I was going to help somebody.
so I want to ask you,
Mhm,
we have a lot of dental viewers here and
mhm.
clinicians. What advice would you give them, or what message would you like to send them with regard to what they do and how it's affected you, or how it could potentially affect other people?
You know, I was not an advocate for a dentist in my pre-cancer. I didn't want to go. I didn't want to do those things. But I tell you what, dentists and hygienists have the ability to save lives.
Hmm.
I didn't realize the power of being a tooth doctor, so to speak, right? I did not know the things that I know now. I am in complete awe at the capability that you have to change someone's trajectory, to just educate them on doing better or eating better so they don't have bleeding gums, so they can maybe not have a heart attack down the road, or vice versa. You're not just saving teeth, you're saving lives. And every person that's in that chair is somebody's loved one. And I know now that by the word of mouth and the praise that someone gives is probably the best referral you're ever going to get.
Oh, I love that. That's such an incredible, just an incredible message to send them. What would you tell patients with regard to this whole process and dentists?
I honestly, patients should listen to their dentist more. That sounds so bad, but it's
So bad.
true. It does, because I was one person that questioned what I was being told. I questioned if I needed to go get better imaging. If they hadn't have made me go and they hadn't have followed up with me, I wouldn't be here to talk to you today. I, so I think that patients should give their dentists and their dental teams a little more credit about their education and what they can do to help them, because truly I know that they do have the best outcome in mind for the patient. They want the best life for them. They want them to be healthy. They want them to eat good. They want them to have good hygiene and gums. I know now that that means several other things in your life. And I don't know that patients understand that. So I think it's really important for a patient to trust their dental teams.
Oh my goodness, what an incredible story. What you're killing me. Okay.
No, don't do it.
I know. Stop.
I know.
Ha. All right. This is about you. First of all, thank you for joining us.
Yeah.
Thank you for sharing. You know people who go through this and they don't make it.
I do.
And I didn't think this was gonna happen to me. Shit. Oops, I'm not supposed to say that. But it's very inspiring. It makes you feel really blessed, and I'm just thrilled that you were willing to do this. If people wanted more information or people wanted to contact you, what would be the best way to do that?
So I'm always available on my website at ayoungsurvivor.com, which is my name. and what I did. So it's kind of fits. And then also at the oralcancercause.org. We work very diligently. And the one thing I would like to say about that is that HIPAA prevents a lot of people from getting information sometimes that they need. And where you can't share a patient's information with us, you can always share our information with patients, right? We've helped people pay power bills, daycare, get dentures, get implants. Sometimes it's something as simple as sending Stella Life products or something to them to help them going through radiation, or just, and sometimes it's just somebody to listen who's been through it and can walk beside you. So that's what we do.
That is so cool. You know, we do these stories. Got a message here. What an amazing story. Thank you for
Oh,
sharing.
thank you.
I want to share that sentiment because that's incredible. By the way, the folks, if you have questions, if there are things that you want, if you like this, please share it. Amber's story is one of the most incredible things that I've personally heard, and I know we've all gone through a lot of stuff. I am inspired by how you discover that everything sucks and nothing exists, and you're like, no, I don't. I refuse to take that. What? 5 years? I'm gonna blow through this.
Mhm.
What hit me was when you said you didn't go past a certain date.
Mm-mm. I didn't. I promise you, there's been a few people who've been with me along the journey. I was scared of it.
Yeah.
I really was. I was scared because believe this or not, I am very data oriented. I was always in control of every aspect of my life. I was a manager for a Fortune 500 company. I had 70 employees underneath me. I was what they used to call the tyrant. So I control I controlled every element of my life. And somehow I was given an uncurable, untradeable, unknown cancer, and it's on a cellular level. So all of the traditional things wouldn't work. And I mean, I read all the books. There might be a mushroom that grows in the rainforest on Tuesdays in December that can cure cancer,
We'll go find
but I,
it.
but I couldn't get to it. So, it became a really deep dive about what do I want to leave behind? And honestly, I mean, I signed my will at 35, my last will and testament.
That's crazy.
You know, when I say every step of the way, I hit a battle every step of the way. I was treated in Charleston, right? I was going down on Father's Day. We went down on Father's Day for my surgery to check in Sunday morning, check in Monday morning at 4 a.m. And we got on our way, and it happened to be the exact weekend of the shooting that happened in Charleston.
Mm.
And when we got there, the house that I had rented for my family in the summer in a vacation town, which is not cheap, right, was completely destroyed. It was destroyed. There were holes in the floor where the furnace was that my son could fall into. And I called the owners. I said, "Hey, I'm gonna need you to come on by." And they're like, we're trying to get back in town. We'll get there. The traffic is so bad." They came in, and what happened was there was workers remodeling the house, and they left when the shooting happened
And they
at the
just
Emmanuel Baptist Church. They quit working immediately. There was no hotels within 350 miles because of all the media and everybody coming there, right? So I asked the owner, I said, "What are we going to do here? I got to check into this hospital and have a surgery tomorrow. I don't know what's going to happen with my family." And he's like, "We're going to take care of it. We'll figure it out." And every day my family would go out and they would repair something in the house and they would come back and do all these things. When I checked out of the hospital, I looked like a walking zombie. And the owner said, "I need you to come by." And they refunded all of our money for the family stay
oh,
because
cool.
it wasn't there, and I was like, okay. Then I got a bill from my prosthodontist. Let's just say, let's call it a bill for this right here. Yeah. Do you know what this right here? So when they took everything out, it shifted my whole mouth and caused a lot of ruckus, is a good word for it. And it was going to be $75,000 worth of rework over the course of 3 years. And I told my prosthodontist at the time, I was out of surgery and I was a little angry. I was 35, and she said it's going to be $75,000 in 3 years. I said, "I don't have that. I don't have that. I'm going to ask you to pull out all my teeth and give me dentures." And she said, "No, I'm not doing that." I said, "Well, I don't have $75,000 to give you." And so she said, and I'll never forget my third earth angel. She grabbed my arm and she said, "You don't know what you're saying." And I said, "Okay." She said, "Do you know what happens to somebody's mouth when you pull out all their teeth?" I said, "No." And she said, "You lose all your bone structure." And she said, "If you lose your bone structure, you're not going to be able to hold dentures." She said, "And I think that you deserve the ability to eat and to smile." And I said, "Well, I don't have $75,000. And she said, if I go and I appeal your case and I get it approved by your medical insurance, will you come here and do this? Of course, I'm a big talker. I said, you get it covered by my medical insurance, I'll come do this.
And you did.
3 weeks later, she got it approved. And every year for 3 years, I would get up 2 times a month and drive 3.5 hours to be in her chair. I would leave at 6 a.m. in the morning. I would get to her chair at 9 a.m. She'd work on me till noon. I would turn around and get home to pick up my kids. I have full crowns, full veneers, 5 implants, been reset. I don't even know how many times. Right? And all because somebody, again, took the opportunity to educate me about how this is going to affect my life and my quality of life, and went beyond, honestly, her position to do it.
So dentists can save people's lives.
Every
Oh my
day.
God. So Amber, thank you so much I could spend the rest of the day talking to you. Really appreciate you taking the time here.
I'm
Really
so
appreciate it.
honored.
Hey, folks, if you have any questions, please reach out to Amber. Amber, thank you so much for joining us. Thrilled, honored that you had the opportunity to do this. Check out the ayoungersurvivor.com oral cancer cause. By the way, I also want to introduce you to the entire Xyrus family. So if you look here, this is the team here. We're excited. We really appreciate you taking the time to do this with us. And hey, at some point here, 10 years from now, would you like to join me back to tell me how you're doing?
I absolutely would. We should. It's a date. I'm gonna put it.
Done.
I'm gonna put it on my 10-year calendar.
Done. Excellent. Hey, everybody, thank you so much for joining us. Amber, thank you for taking the time. What an incredible story. So inspiring. You make me feel incredible. And it's just awesome. Thank you so
Thank you
much.
for having me. I'm so grateful to you.
Oh, likewise. Have a wonderful week and weekend. I'll see you soon.